My name is Fabi Hood, and I'm one of the type 1 diabetes warriors. Here with me, I would like to welcome you to our broadcast known as Cook Ground. And here with me, I am with one of the defiants. You may be asking yourself, what's the meaning of DEFIA? DEFIA stands for Diabetes 1 for the youth. On my left, I would like to start with one of the defiers.
Hello everyone, my name is Hamidia. I am a type 1 diabetic of 19 years now. I am a global community lead with DeFi Initiative. I am into a lot of things, but briefly, that is me.
Hello everyone, co-ground with you is Darren Mohanji. I've lived with diabetes for 26 years and I'm the events lead for DeFi.
Hello everyone, my name is Ben. Been a T1D for 9 years now, and I'm the finance lead at DeFi Initiative Uganda.
Hello everyone, I'm Imi. I'm a type 1 diabetic and a defiant for the last 17 years. I am also the legal aid and publications lead at DeFi. And you are welcome to Cook Ground.
So, you may be asking yourself, what is Cook Ground? Here, I present to you the diabetes lifestyle, the diabetes challenges, the ups and downs. So, we are going to know, what does it feel like to be a diabetic? How do diabetes live? And what do we expect from the society? What does the society expect from us? What are the myths around all this? Today, in today's session, we're going to have 3 main topics. Our first topic is going to be about the myths. The second topic is going to be about the quiz. And guess what? The third topic is going to be about the tea. With the myths, I would like to start with mine. They usually say that diabetics are not allowed to eat sugar. Is it true? I would like Hamida, please, to clarify on this. What do you think about this?
Well, I think there is a lot of misunderstanding about living with diabetes and food. But honestly, the moment you have your sugar levels managed very well, and you can easily just eat anything you have to eat as long as you have management for your sugar levels and you're doing everything as it should be done. There is clearly no need of being restricted from it. Don't eat that, don't eat this. You just have to be you. Food doesn't really limit us from doing anything that we want to do or anything that we want to eat.
Mind you, we also need the sugars, because you find out that sometimes we suffer from a condition called hypoglycemia, where you find that our sugar levels are low and we need the sugars. In this way, we can have a soda, we can have sweets, any sugary thing. So that's why we are not limited from eating sugars. Hamida, which other myth have you ever had?
Well, there are very many things, I've seen people relating mental health to diabetes.
True.
Which is a very big misunderstanding. Someone once told me, you've been experiencing low sugar levels. Maybe that is why you cannot easily remember things very well. Clearly that was stigma, it was very bad. But I think we are here to teach people what is right and what is not right. So please, whoever is watching this or listening, please be informed that those are all myths. Those are things that people say about diabetes which are not true. Yeah.
Thank you. Darren, what have you heard, that myth that has really knocked your heart and you really want to clarify about it?
Yeah, some people say short lifespan, that we living with type 1 diabetes, you don't stay long. Yeah, I hear that.
Oh, no.
And I've spent 26 years with diabetes.
Wow.
I have no problem. I can run, I can play, I can do everything.
True.
I have no problem. So I think I'm a living example of you will live even longer, because I expect to reach 100 years.
Amen. Joy, what do you think about that myth that has really knocked you down and you're like, one time when I get an opportunity, I need to clarify about this?
Yeah, I think there is one where they say T1Ds. T1Ds, I mean type 1 diabetics. T1Ds, they can't produce kids. Oh, so heartbreaking. Yet we have so many of them, so many, over 100, which have children, they have families, including me, myself. So it's clearly myth. Yeah. I want to downplay it.
That is a very big myth. We can still have children, guys.
Yeah. Definitely.
Yes, Amy, I know you have that burning one. I can see it.
Thank you. Well, I think this will directly follow what Bernard just said.
Yeah.
Most people think diabetes is contagious. It's not. Yeah, I cannot pass it on to you. Specifically type 1 diabetes, it is not contagious. And for the audience that may not understand what I mean when I say diabetes is contagious, okay, we know how hepatitis B can be passed on through sweat, blood, coitus, and all. So diabetes cannot be passed. It is not contagious. Yeah.
Oh, thank you. So, anyone watching out there, I know you have been any diabetic. I'm talking to the diabetics. So, anyone who is there out there and you feel like you have that myth, you can please share it through our comment section, through our email, because I don't feel like there is that strong myth that can bring us down. We are really amazing people and no myth can destroy our destiny. So in the other topic we have today, I would like us to have a quiz. And I think that will be directed by Darren.
Thank you, everyone. This quiz is open to the audience. To us, we are going to give answers here, and to the audience. You can put your answers to the comment section. We shall send you marks.
Feel free to give out any answer. We are here to clarify on each and everything.
So to the defies here, I'm going to give 5 points to the first person to raise their hand, and 2 points in case the other person fails the question.
Interesting.
2 points to the one who will answer the question. Yeah, I'm going to start with is type 1 diabetes contagious?
No.
Those
He
are
answer
5
young.
marks for Amy.
Can you
type 1
please-
diabetes is not contagious.
Can you clarify on that?
Yeah.
Somebody out there may not know the meaning of contagious.
Yeah. Contagious is like, can it be passed on to another person through, like how Amy had said, through blood, through sweat, through air, and
Sexual intercourse.
sexual intercourse as well. It can. It can't. Even if I donate blood to a person without type 1 diabetes, there's no way they'll get the type 1 diabetes.
Yeah, these are questions our in-laws ask us.
Yeah, they already
A lot, they come up a lot. You know, you can't have our son or our daughter because T1D. We don't want this to run through our family. No, it is not contagious.
Our in-laws behave.
Yeah. Okay, excluding you. Okay.
They should behave.
So my other question is, I need only 4 types of diabetes. 4 types. It has very many types. I'm told they come up to 26. But I want the 4. The 4 you know. And you explain how they work. Who's answering that?
Darren, you just want to finish us from
Yeah.
Type 2. Type 2 diabetes.
Okay.
For
Let me open it to everyone. We are 4 people. I want 4.
yeah.
So if you give us 2,
was
you get 7.
I was giving you the one.
Give me one.
Yeah. Type 2 for our elders, people who have grown. Yeah, in
How does
age.
it work?
Yeah. So
How does it come up? How does it come up?
okay. So this is when their bodies don't produce enough insulin. Yeah. and they say actually it is reversible, but that's for the doctors. I don't know.
No, I'm not satisfied with that answer. Does anyone have anything?
I understand type 2 as a condition that anyone can actually have type 2 diabetes. Partially, the insulin is working, but partially within the body. Okay, so that itself defines type 2. There are very many factors which cause type 2, like eating lifestyles, weight, those that I know for now. But we should also know the difference, because there is a major difference between type 1 diabetes and type 2. So when we go back to the myths, very many people relate food as the cause of diabetes in general, even if you're type 1, which is not true. So we need to have their understanding of that. Type 1 diabetes is not caused by eating too much sugar, or, and even type 2, they don't need to be stigmatized, given the fact that, okay, I have type 2 diabetes, I got this because maybe I had so much sugar. No, that is not right. It should be stigma. And by the way, language matters a lot. So let us understand the differences, but let us not stigmatize people living with both types of diabetes.
Do you have anything?
Yes.
Okay.
So you have heard us say we are T1Ds, we are type 1 diabetics. We have not told you what type 1 diabetes is. So type 1 diabetes is a condition where, so we are all human beings. You are possibly normal if you're watching this, or you are on this other side where you're a type 1 diabetic. We all have pancreases. They produce insulin, okay? Now, insulin works as a key for your body cells to get energy. Now, in our scenario, our pancreases are the beta cells in the pancreas attack the insulin producing, which are the beta cells, right? So when they are attacked, the insulin production either really stops or it really goes so low the body cannot detect it. Now, that is where the insulin which we take comes in. So we are insulin dependent. We are insulin dependent because as human beings, we need insulin to function, to think, to write, to walk, to breathe, to do all of these things. But also, like a cherry on top of the cake, we need it for our food. Because if you eat and there is no insulin for your body cells to get that energy, your sugar levels are so high, but your energy levels are very low. So type 1 diabetes is majorly not having that insulin in your system, being insulin dependent. So yes, we do take injections. We are not junkies. Also, if you see the syringes, do not involve yourself. Please stay away.
Actually, some people just fear us. When they see us pricking, taking the shots, they have that weird reaction they give us. Guys, stop.
Also, guys, we fear injections too,
We
but
do fear
we are
them
just
too.
gumite. Yeah. But yes, that is type 1 diabetes in general, and that is what we are here to put out, okay? So that you know the signs that we know and that you are aware. Thank you.
Do you have any type?
No. I actually know two, and they have helped me.
Me, I have another one.
But she has another one.
Okay.
There's another one. Yeah, bonus points for me. So this is mostly to the pregnant women. Gestational diabetes, okay? I may not have the best explanation, but it develops sometimes while they are pregnant, okay? And you have to look out. So as you're going for antenatal, always look out for that. Once you see your weight going a bit overboard, or you find that your pressure is increasing over time during your different trimesters, always look out for that. Yes.
Thank you.
I like the sound of diabetes.
I've had as for 4, I got the gestation type.
Yeah.
I've had the type 1 and 2. Type 2, the answer wasn't. I gave only one point to these guys. The answer I wanted was with type 2 is this is a type of diabetes where the body can no longer use it's not able to use the insulin the pancreas is producing. The pancreas is working, it's producing insulin, but the body cells are no longer able to use the insulin.
Okay. I want to defend my answer. With type 2, okay, you're explaining it in a scientific way, but the body is just producing partially, you know?
A little
Is
bit.
it some?
Yes, a little bit. That's why for them they don't need insulin, because we know that type 2, we can define it that your pancreas or the beta cells responsible for producing insulin are totally not producing that insulin. So for type 2, the difference is the insulin is there, but very little insulin. That's why they need to take those tablets.
Okay.
However, if someone does not manage type 2 for a long time, usually they are actually advised to go for insulin.
The
So I don't know
injections.
if that clarifies my answer.
I guess I've left it to the audience.
They'll give us that.
Yeah, they'll give
exactly.
us the because for us we are type 1. You can excuse us for that. So we have also type 3C. That's where the type 3C is where it comes with malnutrition. Malnutrition is type 5.
Nutrition.
Yeah, malnutrition comes with type 5. Type 3C is it comes with forgotten. Does anyone remember? Type 3.
I would like we give that to the audience.
Yeah, let me leave that to them.
I would like them to get
As I said,
engaged.
we are type 1. You can excuse us for the rest of the types. The next question is thirsty is a sign. I want to know, thirsty with a type 1 diabetic is a sign of what?
I like simple questions. Why don't you give me that one?
Go ahead.
So, when our sugars are high, we usually find that sign most common around there. Because you find yourself, your sugars are high, you get that. There are many signs, but that is also inclusive. Because you'll be thirsty, because that your body will be demanding for something to reduce the sugars. So that sign usually comes in there. But though, there are some people who say, have different body types. There are some people who are like, for me, when my sugars are low, I experience it too. Has anyone ever experienced it though?
Me too.
Not to me.
So, okay, so yeah, it's a two-way thing.
Yeah, it's a two.
Yeah, but it's
actually,
more common in people who have like high blood sugar.
High.
Yeah.
That's why I chose that. Most of the symptoms can come both ends.
Yeah.
Yeah, like you can get more hungry when you're in a hypo and in a hyper. High blood sugars and low blood sugars.
Sure.
Yeah, and you can feel some headache both ways.
We are both ways.
Yeah, that's why I looked for
Blurry-
thirsty
blurry
because
vision also.
thirsty most of the times comes when you're in with high blood sugars, and that Swabi gets 5 points. Now,
You didn't mention how many I got.
okay. My next question is, name any European footballer. If you don't know any footballer, you can even give me a basketballer with type 1 diabetes.
I've got you.
Let me start with Amida.
This is a friend of mine who lives. I met him during the.
He's Ugandan?
conference.
European?
He's European.
No, he's from the UK.
UK.
Okay.
He's called Chris Bright.
Hi, Chris Bright.
I know he's a footballer.
So, Kasper Dolberg,
Who?
A basketballer?
a football player. Yeah, he used to play for Nice
Yeah, okay.
and Ajax. Hey, he's a T1D.
Is he a retired or he's still playing?
He's active.
He's active.
He's from Denmark. He's an
Hi.
international. He's a striker. Hey.
Sabi, do you have any?
No, actually.
Yeah. Me, the most common one, I think everyone viewing here who supports football that they know is Nacho Fernandez from Real Madrid. He was diagnosed at 13 years. Yeah.
He's no longer at Real Madrid.
He's
Anyway.
no longer.
Yeah.
Yeah, 2 marks. But still, Nacho. Okay.
That's nice.
I think there is even someone in basketball. and tennis.
Yeah,
And tennis.
We have
mm,
very many celebrities. There are
So where does
musicians
that put us? That we can actually, there, as diabetic people, you can do each and anything. So don't be there and you limit yourself that I'm diabetic, I can't do this.
you can do
See
it.
from them.
Darren,
Even
I also
actors.
have one
Okay.
representing the women, Andrea Pereira.
Yeah, you know what?
You
Why
can
didn't
pay
you
me.
mention?
You can pay me for telling you. For the women, and Darren for the women.
Who knows Pavia in Uganda? Pavia is a warrior. Apparently, like around the time when he was diagnosed, was actually going to qualify for the national team, but he did not because the diagnosis and everything. So for me, I know him as one of my footballers.
Shout out to Pavia too.
Another warrior. I may not know her first name, but she's Elizabeth. She swims. She's a swimmer. Yeah, and she has, I think, been either to the semifinals or finals. I'm not so sure. Yeah.
Oh, and on this show, we actually have some lawyers and engineers.
actually, Darren,
So by the
There
end of
is
the
a-
show, I want you to spot out who's the lawyer and who's the engineer.
there is one. Okay, I don't know the name,
Yeah.
but I want to mention her. She plays for the national team of Uganda basketball.
Oh.
A white lady. She's also T1D. Yeah. So you guys can look up the name because yeah.
Yeah, you see, diabetes can't stop you from anything. Yeah, my next question is I want a type of food. Any?
Samosa.
That's her favorite, I think. Why did she pick the mic so fast?
Ndizi, baby ndizi, sweet bananas, the small ones. 15 grams.
Right?
One is 15 grams, then bogoya is 30.
How about if I measure that in sugar? 15 grams sugar.
Sugar.
Hey, it counts
Like food, I want
like a spoon of sugar. 15 grams.
Like
Hey,
sugar is sugar food.
mama nkutidde.
Okay, I'll give you 1 point for sugar.
See?
Okay, let me see whether I have any other questions. I think we're done with the quiz. Oh, one more quiz.
Feel free.
One more quiz question. What type of diabetes occurs when the body stops producing insulin? What type of diabetes occurs when the body stops
Can I try?
producing insulin?
But if I fail, you give me half for raising up
problem,
first.
No problem.
Yes.
No points
Type
for
of
trying, you know.
diabetes.
Yeah,
Yeah, he didn't differentiate, did he?
it does. It does. Yeah, it is type 1 diabetes.
In fact, give me 5 for being confident.
It was already said before.
When?
You're just copying. Yeah.
Today's quiz, I'm going to give you the winner of today's quiz with 9 points is Swabi.
I know.
Okay.
So thank you, Darren. If you're out there and you have those burning questions, in our next episode or broadcast, please feel free. We will start with any question you would present. So, in our last session, we are going to have some tea. When I say tea, some of you know it as Lugambo, but I'm going to term it as tea. So, I feel like I should direct it back to Darren. Darren, what has been going on that has made your ears not rest like?
The speed at the way fuel prices are going. I think we're going to buy an electric vehicle now. Fuel is going high. How are we going to travel to our medical places to pick drugs?
Oh, yeah.
They are also as border riders, I think.
Yeah. Taxis are going to, the prices are going to go high. Buses, I know some of us take buses to the medical store. So how are you going to plan?
Yeah, actually, we have some type 1 patients who come far from Barara, And you may find their clinics are in Kampala, so this is going to affect them deeply. Government, this is yours.
We have had.
Yes, Hamida?
Hamida, you have any of some Uganda?
Yeah, you guys, have you seen how insulin is expensive these days?
Yeah, is it?
What was your first time? Okay, my first time going to pharmacy to buy insulin was, I think, last year. And my goodness, I think we need to pay more attention to the policies around the price of insulin in Uganda. Like, it is insane that you have to buy one insulin pen costs 48,000, like Grantas. A pharmacy that I know, and if you have to use like 2 pens
A month?
that is literally someone's salary. It can be someone's salary, literally. So for me, I have, been down about it because I know that there are very many diabetics right now in Uganda
Who can't
are going
afford.
to struggle with
Yeah.
affording insulin. It's
True.
very sad, and we are very many young people are living with diabetes in Uganda, and given the fact that the price of insulin is high, and I feel like it needs more attention, and even access to insulin when you're older is a major challenge. So I feel like if we can give more credit to the people who actually brought the access of insulin in Uganda right from 2010. And the CDIC has been involved in that for a very long time to date. And honestly, you only get to know when you have to really buy insulin.
And by the way, an insulin pen, has 100 units. And sometimes a day, you can use a minimum of 15. So imagine how long that takes you, a pen at 48K. So it's really expensive. Most of the people who barely survive in today's economy, everyone knows people barely survive. So it's
Olawafe ab'e Kampala tukaaba kati. Ab'omu
Those in
kyalo,
the
what are they
village.
gonna say?
Those are-
What are they gonna say?
Me, I'm even reducing on the meals. I want to keep my long acting for a long time.
you're substituting it for herbal.
It's that serious? Yes, Amy.
Siri nnyo wa lugambo. And Darren has said quite a lot. The rest I will tell you when we meet again, co-ground. He mentioned something and it just reminded me. Bernard said herbal. Most people think herbal medicine cures diabetes. It doesn't. Yes, some herbs do help with lowering sugar levels and doing all that, but it does not cure type 1, to be precise. Yes, cannot be cured by herbal, and herbal medicine should be taken in moderation. There are herbalists who are, what do they call them? They are qualified, certified. So get an actual prescription so that your kidney does not pay for your choices.
Actually, I've ever seen that. There are some parents. Parents, you are usually around many people. Ojja laba waliyo omuzadde agenda ovaayo agambe muzadde munneewe mbu nina omuntu eyanywa eno habo neeyamba ku mwana n'ojja omwana wo ku insulin. That is not right. You're going to kill your children by yourself. If that doctor said you shouldn't take that child away from the insulin, please don't. Those herbal medicines are not going to work. I myself, I can testify. I've ever tried it and it doesn't work.
Isn't
Stop
there any
your insulin.
diabetic who hasn't tried? I think all of us have taken our
So all
fair
of you
share.
have actually tried. That's a killer disease too.
Maybe just to finalize as to what everyone has said, yes, insulin is quite expensive. Currently, it is out of stock in some of the major clinics.
True.
And well, the vials come with syringes. The pens still do come with smaller, fine needles. But we appreciate everyone, the donors, the organizations that have spearheaded this distribution in Uganda for more than 10 years now. Thank you.
Yeah, maybe on the cause of herbal medicine, I think we are also still struggling with the community because I was scrolling through TikTok a few weeks back and I saw a post which was literally from a celebrity, known celebrity in Uganda, big brand ambassador of a big company, and she was literally having an advert of herbal medicine curing diabetes. You know? I feel like we also need rules around what you can say about diabetes and what you cannot say, because this brings in the misunderstandings that people have about the condition. You know? Yeah, I think even the podcast should do a lot more for people to understand what is right and what is wrong. So you just have to stay tuned.
Yeah. I'll put this message across in Uganda to the people, most of our elders in the villages, ab'omu byalo. Temujja baana ku insulin. Ng'olwokuba abasawo, omanyi wali abasawo ba mu byalo eyo. Wamanyi oyo atabula eddagala kakensa mu bbombo. Oba omululuuza. Temujja baana ku insulin. Olw'okuba musawo gundi agambye alina eddagala erisobola okuwonya omwana. Tetwagala baana batufeeko mu ngeri bwetyo. So mugende mulina abasawo ku byalo. Musooke mwebuuze ku basawo nga temunnakola decisions bwezityo. Kyensaba ekyo.
To add on that point, go to real hospitals, not clinics. I was at the Mwategera clinic than hospital. I don't know, is it because of the money or... But please, life first.
It's an African setting.
Do you realize how it is very affordable to go to like a regional referral hospital for chronic conditions? Of course, you can't manage. It is very hard to manage diabetes maybe outside in a private clinic if you're not financially
Stable.
But if you go to a general hospital, like our clinic in Mulago, you will be surprised. We have good doctors there. Dr. Terry, she's always there on Tuesday.
Shout out to Dr. Terry.
Help these young children living with diabetes. So,
and to the parents who discriminate children because they have been diagnosed with type 1 diabetes.
Even society.
Yeah. There are so many cases. When you think about them, the ones I've seen, it is really emotional.
Actually, I feel like everyone who is diabetic, truth be told, you have been discriminated in one way or the other.
You know, they tell us it is a curse.
True.
Someone tells you that's a curse.
It's a curse, yeah.
We need to, some even send us to pastors. Imagine. Oh my God.
A pastor to cure diabetes,
Hey,
really?
to pray for you.
I would like to know, like, all of us have been prescribed to herbal stuff. Like for me, there's a time they told me to boil pumpkin seeds and take the juice.
And
So,
leaves.
what about you?
Actually, for me, back then when I was diagnosed, it was Kaziri.
Kaziri.
That green one.
The sour one. Yeah, it was bitter.
That one.
I have a friend who they said, like, for them, okay, the mom tried everything and they sent them to Kenya to the witch
doctors.
doctor.
yeah, witch doctors, and they sent them for a crocodile breast.
Darren.
What?
Yes, serious.
A crocodile breast.
Please, we need you in our interview next time. If you know you're that person,
I can't mention.
we need that story.
Guys, I have a weird question. Does the crocodile have a breast?
That's why I say
No,
we
like
need
I'm
that
looking,
person.
I'm just picturing what I've
We
seen
need to
on...
find out. Were they even able to get to it?
Okay.
Okay.
And adding on our gamble, I think I'm feeling sorry for the Arsenal supporters who are type 1 diabetes. That Arsenal lowering their blood sugars.
That tension.
The tension.
True.
Sorry for them.
Kati omwogezi wa Arsenal nkoze otya?
Sorry for that. Keep money.
Emotional damage.
Yeah.
Bad. Anyway, by the way, Arsenal fans TV, they are in Uganda.
Hey, really?
They
Yeah.
at Serena.
The guy, what's his name? The fat guy, black.
One wakapata.
Yeah.
I don't know, but
Yeah, he was here.
Yeah.
Recently, I was in India for a conference called End Diabetes Stigma. I know that our conversation has reflected on that and the needs, but there is one thing that I really learned from there is how we use language. See how people say, right there. I don't want to use that word always when I'm relating to diabetes. I don't know about you guys, but I prefer saying, okay, condition.
Oh, you
Uganda,
mean
they say
Mbera,
or
okay.
you can translate it in any language, but the way how we address the conditions we live with. I know there are people who live with different NCDs, but the way how we address these conditions, is it something that you guys pay attention to? Like the way how people communicate to you while living with diabetes, does it lower your self-esteem in any type of way, or you just don't care? Because for 19 years living with diabetes, honestly, if someone comes with a negative comment about diabetes, I may not really care for now, because I know, if you know, you know. But for someone who is probably not exposed, or you have no family of those living with diabetes, like the family as we are here, Fiat, okay? What is your view on the way how people use language?
I feel like, to me, when I've been growing up with diabetes, there are many challenges, like up downs I've got. So in this way, like a person my mom would be like, oh, so biafuna sukari. Then these people would term it as ngaya mufuna ku myaka emito obulwadde bw'abantu bakulu. Like, guys, you can get diabetes at any age. It's not si mukulu si muto. This condition comes just at any age. So mulekerawo making a diabetic people feel, oh, abufunye mutonyo mukuru nnyo. This condition just comes, oba nawe tokyeyagalidde, it can come at any age rate. Yeah.
the pity, eh?
Yeah.
You hate that pity. Yeah.
Yeah, adding on to what Hamida said, diabetes is a condition, like weather. Sometimes it rains, sometimes it shines. So with diabetes, sometimes it's high, sometimes it's low, and sometimes it's normal. So diabetes is just a condition. It's not like, I don't take it as a disease, and we're not sick, because in seconds, one of us could get a low blood sugar, and they will take a soda or anything to correct it, and later they'll be okay. But when you're sick, it will take more than 30 minutes to treat you. When you have malaria, I don't think there's an injection that
By the
acts
way,
quickly.
in our next topic, we should bring that condition when you're sick with type 1 diabetes, so these people can know when a person who is sick, how does this?
How can you help?
Yes, true.
So it's a condition, a quick condition. Hypers, the high blood sugars, can be treated in seconds. In minutes for high blood sugar. It can take Novorapid, it can take 20 minutes, 10 minutes. Then your sugars are corrected. Then when they are low, a soda, a juice can drop, can put your sugars to normal in just few minutes, like 5. Yeah, so it's a condition. But when you're sick, malaria, you need to go. They'll need to inject you and lower you.
Yeah, and some malaria injections lower down the blood sugars.
Yeah.
Actually.
things like that take long. Sickness takes long. But the condition, just seconds. Rain, if it starts raining now, it will hardly rain for more than an hour. It will hardly.
Sometimes.
Sometimes,
Yeah.
but not for the whole day. In Uganda, yeah. So but when you're sick, when you have malaria, flu, treating flu take days, weeks sometimes. So this it's a normal condition.
Yes, Amy?
Thank you. Thank you, Hamida, for bringing that up. I would maybe look at it. This is mostly to our fellow warriors. What Hamida said, language, takes me to mindset. So you're seeing everyone here, it's 9 years plus, 10 years plus. We have been in those situations where you find a diabetic, how you present yourself, diabetes aside, even as a person who's very normal, the way you present yourself is how you are perceived, is how you're treated. If I'm going to come out with a pity party show, victimizing myself, being like, oh my God, I'm sick, that is how you're going to be treated. The moment you shift your mindset to championing your life, to saying, I'm going to take the steering wheel and manage this condition because it's actually manageable, you'll find that how people respond and how they speak to you changes. So just like what they have said, this is all positivity. This is all choosing to go a particular direction. So that is something we should all embrace. It's not easy, but when you wake up, take it one day at a time. And a day has 24 hours. What you do with those 24 hours is all on you. So your first 12 hours or your first 6 hours, if you do not wake up right, you can make it right. So be positive, have a clear mindset. If you're not ready to come out that, oh, I am a type 1 diabetic, take your time. We do not want it punching you hard.
Yeah.
And you cannot even talk to us. Okay? So you're not alone. We are here. The clinics that you are at are there. If you're there and you do not know that there is a community, there is one. We are here. Feel free to comment, feel free to ask, feel free to reach out when you see this. But just know you're not alone, and your mindset matters a lot because it will determine the language you use with yourself and that you lead and accept people to use with you. Yeah.
Thank you, Amy.
Maybe
Perfect.
a little. This may be a message to people who employ us. I have seen many young people living with diabetes in Uganda struggling with the stigma they face at work. It is very sad, it's a sad reality, but if I give you an opportunity to open up and tell you, I live with diabetes, but I am okay, come on, take it slow. I'm not going to die, I'm not going to fail to do what I have to do. I mean, if I have lived with T1D for 15 years, expect that I can do work. So the stigma around how people treat us at work, the language used within the community, we just need to be a little more kinder. Okay? If you see someone living with HIV or diabetes or any other condition, they are able to do what they have to do. By the time someone achieves a bachelor's degree in law, I mean, Imi, Ivan.
Oh my God, you've given them the answers.
I know, right? There is no way that someone cannot do what they went to school for, So for me, I feel like the general public needs to know that people living with diabetes can literally do anything.
Thank you, Hamida.
We have an engineer.
And politics, but maybe for another day.
Okay.
But we have someone who actually.
I think they should just know the politician.
Who made it?
Yeah, who made it?
Hey.
Over here, among the 5 of us.
We have a gumite
We have a gumite.
among us. We have an engineer here. Huh?
An
events
engineer,
planner.
a lawyer, then search who the politician is.
Yeah. And also as the type 1s, right? We shouldn't use it as an excuse because we are normal.
We are.
Differences, the difference is that you, the normal ones, are taking insulin. your pancreas are
Producing.
producing insulin and using it by itself. But for us, we have to do the pancreas's job by taking the insulin ourselves. But the rest, we're normal. So don't say, I have to sleep more than 11 hours because I'm diabetic. No, we shouldn't use it as an excuse. So that also our bosses, also those people employing us, they don't limit us. They have, he's diabetic, but he'll carry that thing, he'll carry it. It's okay. He's diabetic, but he'll manage to work for 8 hours. So we shouldn't use it as an excuse. We should work as we can. Yeah, so we shouldn't feel sorry, and they shouldn't feel sorry, too sorry.
Don't over pity us.
Don't over pity that.
Sometimes.
Ivan today he won't be able to play for 90 minutes. I think he'll play first half. Even if he scores 3, we need to limit him. His blood sugars are going to drop and he might die in the field. No. Nacho plays for more than 90s, even if they go to extra time. The coach never says he's playing nice, but he might die on the field. That's risky. That doesn't happen.
Thank you, Darren.
Given the mission, the values of my initiative, I honestly feel like even this podcast is going to be a beautiful platform for us to express how we feel, achieve ground, so
I feel like when the more our sessions will go on, we shall have a platform where you guys will reach out to us, those who feel like you would like to join and share some message that each one of us may not have, and you feel like you would like to come and elaborate more. You'll reach out to us, to Ivan, and you'll join us one time, which is amazing. Yes. So, with all that said, today I would like to tell you that if you're a diabetic and you're out there, I would like you to know that living with diabetes is a full-time job. You are like a person who is on a job without rest. This means that your life is in your hands, like the ball is in your hand. You can either score it or you can either kick it away. So if you want the community to understand you, understand yourself better. Because if the doctors and your parents, if you have parents and they take care of you, it makes it more easier for them to understand you if you understand yourself first. So any diabetic out there, you're not alone. We are always here for you. And I pray that also the community understands this situation, because today it might be me, the next time it may be one person in your family. So love each one and everyone who is suffering from diabetes, and it's not the end of the world. You never know, the next president may be me. But anyway, thanks for tuning in. We love you. Keep on our next session. Bye.